Welcome to an in-depth look at autoimmune retinopathy, a rare and complex eye disease where the body's own immune system mistakenly attacks the retina. Join us as we explore the causes, symptoms, diagnosis, and treatment of this vision-threatening condition. Autoimmune retinopathy, or AR, arises when the body's immune system, which normally defends against foreign invaders, misidentifies retinal proteins as threats. This triggers an autoimmune response, leading to inflammation and damage within the retina. The precise reasons for this immune system malfunction are still under investigation, but genetic predisposition and environmental factors are suspected to play a role. The pathophysiology of autoimmune retinopathy involves a cascade of events. Immune cells, such as T cells and B cells, produce antibodies that target specific proteins in the retina. These antibodies bind to retinal cells, activating inflammatory pathways and causing cellular damage. Over time, this ongoing attack leads to progressive retinal dysfunction, including photoreceptor loss and vision impairment. The targeted retinal proteins vary depending on the specific subtype of AR, further complicating the disease's presentation. Autoimmune retinopathy is considered a rare disease, and its exact prevalence is difficult to determine. Due to its heterogeneous presentation and potential for misdiagnosis, it is likely underreported. While it can affect individuals of any age, it is more commonly diagnosed in middle-aged and older adults. Research efforts are ongoing to better understand the true extent of this disease and identify at-risk populations. The signs and symptoms of autoimmune retinopathy can vary widely from person to person. Common symptoms include progressive vision loss, difficulty with night vision photopsias, which are flashes of light, and changes in color perception. Some individuals may experience rapid vision decline, while others may have a more gradual onset. Due to the variability in symptoms, it's crucial to seek prompt evaluation from an ophthalmologist if you notice any unusual changes in your vision. Diagnosing autoimmune retinopathy can be challenging, as it often mimics other retinal disorders. The diagnostic process typically involves a comprehensive eye exam, including visual acuity testing, fundus examination to visualize the retina, and visual field testing to assess peripheral vision. Electroretinography, or ERG, is a key diagnostic tool that measures the electrical activity of the retina and can help identify retinal dysfunction. Blood tests may be performed to detect the presence of specific autoantibodies associated with AR. However, the absence of detectable antibodies does not necessarily rule out the diagnosis. A thorough clinical evaluation, combined with appropriate diagnostic testing, is essential for accurate diagnosis. Autoimmune retinopathy can be broadly categorized based on the type of retinal cells primarily affected and the specific autoantibodies identified. Some classifications include cancer-associated retinopathy, or CAR, which is linked to systemic cancer and targets photoreceptor cells, and melanoma-associated retinopathy, or MAR, which is associated with melanoma. Non-paraneoplastic AR refers to cases where no underlying cancer is identified. Further sub-classifications may be based on the specific retinal proteins targeted by the autoantibodies. The treatment and management of autoimmune retinopathy aim to suppress the autoimmune response and reduce inflammation in the retina. Systemic immunosuppressive medications, such as corticosteroids, are often used to dampen the immune system's activity. Other immunosuppressants, like azathioprine and mycophenolate mofetil, may be used as well, especially for long-term management. In some cases, intravenous immunoglobulin, or IVEG, therapy may be considered. Local treatments, such as intravitreal injections of steroids, may be used to target inflammation directly in the eye. Regular monitoring and adjustments to the treatment plan are necessary to manage the disease effectively. Currently, there are no proven methods for preventing autoimmune retinopathy, given the complex interplay of genetic and environmental factors involved in its development. However, maintaining a healthy lifestyle, including a balanced diet and regular exercise, can support overall immune system function. Early detection and prompt treatment are crucial for slowing down the progression of the disease and preserving vision. The prognosis for autoimmune retinopathy varies depending on the severity of the disease, the individual's response to treatment, and the underlying cause. Some individuals may experience significant vision loss despite treatment, while others may achieve stabilization or improvement in their vision. Early diagnosis and aggressive treatment are associated with better outcomes. Ongoing research is focused on identifying new therapeutic targets and developing more effective treatments for autoimmune retinopathy. Scientists are exploring strategies such as targeted immunotherapies and gene therapies to potentially halt or reverse retinal damage. Continued research efforts hold promise for improving the prognosis and quality of life for individuals affected by this challenging disease.